Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here in the studio. And you get your free book when you phone in. It's Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies, and the foreword is written by Suzanne Summers. What do you think?
I love Suzanne Summers. God bless you, Suzanne Summers. She's a great advocate of the kind of medicine that I do. Her new book has a chapter about me and about regenerative medicine and how it worked on her and her family. I've been treating them, my gosh, for the last 20 plus years with good success, thank goodness. I'm going to ask for your calls again at 866-870-5752. You get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And I also wanted to mention Sunday on May 15th, I'm going to be on another radio show of I guess you would call him a famous fitness trainer, and it's on KABC radio, different station. And let me see if I can find the information on that to give that out. Yeah. His name is Rehan Jalali, and he is sort of the fitness trainer to the stars. He's got a book, The Six-Pack Diet Plan, and the Sports Supplement Buyer's Guide. He treats Oscar-winning actors, Emmy winners, TV stars, Grammy-winning people. He's also starting to refer me patients because he had pretty amazing instant success on his torn quad tendons, both knees. He came in and we worked on that. So that's on KABC Radio, 790 AM, and that is on May 15th from 5 o'clock to 6 o'clock. So you can listen in on that also if you like. I'm going to go in the studio and be with him. It'll be filmed, and he's a great guy. He's got a great show. It's published, if you want to call it that. Maybe you have a better radio word for that, Nita, all over the country.
That's great.
Is that the word? What do you use when you have a syndicated? That's the
syndicated
word, right? Yeah, his show is syndicated. So I'm really excited to be on that show on the 15th. So let me see what else I have going here. We do something called the vampire facelift in the office, where we inject the cells from your body, the regenerative cells, into the face. Really? Yeah, it's called the vampire facelift. And it regrows the collagen, makes you look young. We have just as many men and women who do that. It's not just something that females do for vanity's sake. It's not like that. It's something that really is a regenerative kind of a thing, and regrows the collagen. As we dry out, as we age, things don't look as good as they used to. So this pumps it back up and rejuvenates the face, just like I rejuvenate the joints and ligaments and tendons in the body. We also do something for hair regeneration. If your hair is thinning, we can use these same cells on the top of your head. If you're completely hairless, it's not going to work on you. What's our friendly psychologist name? Dr. Phil. Dr. Phil, don't come in and try this. I don't think it'll help you very much. You'll have fuzz that you'll have to shave off. So we have a lot going on in the office, and I'd love to see you there. The number to the office, if you want to call me there or get more information, is 800-300-9300. And the website, if you want to watch videos of me doing these procedures all over the body, I do the entire body, is www.lastemcells.com, www.lastemcells.com. And there is a spot on every single page of my website, which is a very prolific website. I work on it every single day. It's got a lot of articles on healing. And there's a spot to email me. So if you're too shy, I hope you're not too shy to talk to me now, because we're good to our callers. We love you. But if you are, you can always just go to the website and email me from there. And I do responses all day, in between patients, at night, in the morning. So I get back to everybody every single day. And as you folks who are my patients who are listening know, every one of my patients gets my cell number, and I get back. If you call me, I get right back to you if I can't pick up, if I'm with a patient, or you text me. I usually respond within a minute or so. I love communicating. I always did since I was a little kid. And back in the day when I was a youngster, we just really had pretty much letters. I used to write letters every day to my friends and my family, and I used to love getting letters back. I still have letters that my grandfather wrote me, who was sort of my spiritual teacher when I was a youngster. He was a philosopher, medical doctor, and they're very. I look at them now, and they're so fun, because I would write these simple questions about life and truth, and he would write back all these philosophical dissertations. And I have a whole thick stack of these letters of us going back and forth since I was probably like around 12 years old with him. You know, what is the meaning of life? All of these philosophical things that the great masters would discuss with their disciples. So I was sort of his little disciple, and my mom used to, I'll say, force me to spend my Sundays with him. And we would go hiking. We're from Chicago. We would take the train from downtown Chicago to the Indiana sand dunes and hike all day. And he actually had a bunch of followers, and we'd all hike together, and they would discuss philosophy and what makes humans tick and what the world is about. So I grew up with a very philosophical background, and I do love philosophy and spirituality and all of those things. And if you're my patient listening, you know we've probably had these conversations, because I look at it as one of my jobs with people's healing is to have them elevate their consciousness and have them realize that what they're going through is really the best thing for them at the time, and there's ways they can change their attitude, right, Nita? That's what you do for a living too.
Pretty much.
Yeah, Nita is an analytical psychologist, and I studied psychology in college. And it's all about how do you live in this world as a happy human being, doing your best, loving yourself and loving other people, and helping people. That's what it's all about. And that's something I'm very lucky about, because my work as a doctor allows me to have that purpose. And I don't just give people medicines and surgery and all those kind of things. I stay away from that. I want people to heal, and I want them to do it naturally if that's possible. And regenerative medicine has worked on me. I know, Nita, it worked on you, thank goodness. And
Twice.
It's worked on people you referred to me. And it's been a real blessing for me to be part of this movement to bring regenerative medicine to the world. Because when I started, very few doctors did it, and we were the devils of medicine. No one liked us because it worked, and no one believed in it. And, a lot of guys still don't believe in it, unfortunately, even though I know a lot of doctors who do a little bit of it. A lot of orthopedic surgeons do a bit of it, and then they tell their patients, see, it didn't work. But that's not how it works. Sometimes it takes a few treatments to get there. It's not the kind of thing where you do it once and it fails and then you go get surgery. I don't remember the last time I sent somebody to surgery. We just don't need to do it. I'm sure it's happened sometime back in my memory where someone had a fracture or something. I'll send them right to a surgeon. But I've had many, many very difficult cases that we've been able to solve by just injecting stem cells or platelets or some mixture of that. So it's been a great, great life of medicine for me. So, Nita, if you don't mind, I'm going to do some questions here.
Okay, do you want to give the phone number?
I do. The phone number to talk to me right now is 866-870-5752. And let me see if I can get a good question going here. Otherwise, I'm going to have to tell a joke and make Nita suffer. No, I don't want to do that. Okay, Here's one that says...
Answer an email.
I know. Had arthroscopic surgery on both 7 years ago, looking at possible knee replacement. Let's see what this person's got to say. Knee problems. Had arthroscopic surgery on both knees 7 years ago. Doctor said not bone on bone, but steroid and gel shots within the last year did not work, looking at possible knee replacement. Well, I have people come in every day ready for knee replacements who never needed that and did not really have bone on bone. Bone on bone means there is zero cartilage, and most people have some even though they're having pain. So I wouldn't get, I'm going to use the word bamboozled by hearing that you have bone on bone and you need a knee replacement or another joint replacement or even a surgery. The fact this person had arthroscopic surgery, that means, through a port in the knee, make a little hole, put a camera in there with some tools and another port, meaning an opening, and scrape out the tissue or cut things out, is not something I like to see happen. I like all that extra tissue there for cushion, and I don't see the results being great. I think it causes immediate arthritis. So a patient goes in, has knee pain or shoulder pain, whatever, hip pain, gets an arthroscopic surgery. The surgeon says, it's a simple procedure. We just do it arthroscopically. We're not going to open up the joint. And then they come out worse than they came in. So I don't like those surgeries. I'm sorry. Don't beat me up about it. I don't like it. And I like orthopedic surgeons. I just don't like the surgeries that they do that don't need to be done. I think it's time that they look at their own journals that actually do report regenerative medicine, do report how good it works, and do report the problems with surgery. But, it's hard to change the stripes on a zebra. That's what my dad used to say. You can't change the stripes on a zebra. Meaning it's hard. Old things die slowly. And unfortunately, it's a certain culture that doctors grow up in, and they can't seem to get out of it. I was trained in orthopedic surgery, but because of my own injuries, I had to try something else. The surgery on my shoulder failed. I healed my shoulder afterwards by just self-injecting. I got a call here. I'm going to go to Barbara. Thank you so much for calling, Barbara. This is Dr. Marc Darrow. It says left shoulder replacement. Can stem cell avoid getting a replacement? So to find out the answer to that, Barbara, we need to examine you. I need to touch your shoulder and move it around and see what is going on. I can tell you this, I get patients all the time who were told they need a shoulder replacement and definitely did not and never had to do it and are all better now just doing injections.
I have bone on the ball and socket.
Okay.
I just had the last CAT scan.
Yeah.
The torn rotator cuffs are not the issue for the pain.
Okay.
And I'm very hesitant. I am scheduled on the 24th of this month.
Okay.
But I would love to not have to do the surgery.
Okay. May I speak a little bit and have you listen, and I can tell you about it?
Thank
Great.
you.
Thank you. Thank you so much for calling in. So you've told me a few things that I don't believe, and not that you're wrong, okay? But I'm just going to tell you why. It's not that you're wrong. It's just you've been told certain things and you believe them, and I don't believe them. So you said the torn rotator cuff is not the issue. The issue is the arthritis in your glenohumeral joint, the ball and whatever you call it, socket joint. So that's not necessarily true. None of that is necessarily true. I wouldn't be able to give you a real answer unless I touched your shoulder, pressed on it all over the place, and found out where the pain is being generated from, and then moved it around to feel how the motion is. Are you able to lift up your arm at all?
Yes.
Okay. Well, then the arthritis is not that bad. Okay? And I'm going to guess just from you being able to lift your arm, you do not need a shoulder replacement. But I'm not going to tell you what to do unless I become your doctor. And that would mean you have to come into the office and let me do an examination and get your history. I can't tell you on the radio what to do. Do you understand that? I can't tell you should or shouldn't get that shoulder replacement. I can tell you if it were me, I would go to somebody else and get an opinion that's what we call a second opinion. And I wouldn't go to an orthopedic surgeon if that's the one who told you you have to do it, because they're all trained the same way and they all believe pretty much the same thing. So that's not really a second opinion. You need to go to a different type of doctor. Do you understand that or not really?
Yes, of course I do.
Okay,
I have
good.
4 orthopedic surgeons say that I need a reverse shoulder replacement.
Yeah. Well, I don't believe that. I don't believe that from what you've told me. But you getting 4 different opinions is one opinion because they're all from the same tribe. I'm not putting it. I'm not putting the tribe down. I'm just saying they're all trained the same way. I'm trained that way, but I'm also trained another way. And if I listen honestly, Barbara, if I thought you needed a shoulder replacement, I'd be the first guy to tell you that. Okay?
So then the next step is to just come see you.
The phone number to my office is 800-300-9300. And if you want to watch these injections, you can go to my website at www.lastemcells.com. For those of you that want to call in and speak to me right now, the studio phone number where you can talk to me live is 866-870-5752. So Barbara, when is the date? Well, how many days from now is your surgery about, or how many weeks?
In a week, the 24th.
Okay. So I'm going to tell you this. If I were you, I would go to my website right now and email me, and I will get you in as soon as you want to. Okay? Because
all right.
How long would it take you to get to me and get a real second opinion? Not much. And look, I get so many people that have surgeries that they're miserable. And shoulder replacements, I've seen the worst thing happen with them, where that joint, the prosthesis doesn't even fit and they can't move their arm afterwards. So that's not a surgery that I like to see happen.
Okay.
I'm just being honest. That's just my experience. It's not a negative statement about the surgeon. Please, surgeons, don't get mad at me. I love you guys.
I understand. Can you repeat the email to email you?
It's not an email address. It's a website. Every page on the website has a spot where you can email me. So it's www.lastemcells.com. LASTEMCELLS.com.
Got it.
And that's a website, www.lastemcells.com. There's videos on there of me injecting all over the body. You can see if it's something you want to do. And there's just tons of information there that I wish doctors would read, because I don't get it. I don't get why doctors don't continue to learn. I don't get it. It makes me very angry every day, every single day when I hear these things that doctors tell their patients. It makes me mad because they refuse to learn and get with it. There are new ways of healing. Get with it, docs. I love you guys. You do great work, but get with it and learn new things.
In the event that I do need surgery, are you familiar with the reverse shoulder apparatus?
I am to some extent, but I'm not going to get into it because I don't think you're going to go there.
Oh.
Why should I talk about something that I don't think is going to happen?
Okay. Sounds good. I'm going to look this up and email you from the website.
And if you want, you can just call the office at 800-300-9300.
Okay, sure.
And if you have any trouble getting in, I want to get you in right away. I'd like to see you as soon as you can make it, because you need to get more information to decide whether you want a surgery or not. I don't want to keep you hanging.
I would like to come in on Monday if I could.
I will make that happen if you get a hold of us. I'm booked, but you can do that. And if they tell you that there's no room, that it's filled up, you just tell them I said to sneak you in. In the afternoon. Yeah.
Afternoon sounds perfect.
Yeah, I'll make it happen for you.
Thank you very much.
And listen, it won't take me more than a minute to find out if you need a surgery or not.
All right.
The exam is simple. It's just touching the shoulder all over the place, pressing on it, and then moving you around, and then checking your other shoulder and comparing it. It's very easy.
I shall be there. Would you like to, on the air, give me your office address?
No, you can just, don't worry about that. We'll figure that out after you decide if you want to come in. Because we have another caller waiting, and the show is coming to the end.
All right.
So
Thank
we are across from UCLA and on Wilshire Boulevard. All right, Barbara, God bless you, and I'm glad you called in. I hope we can save you from a needless surgery. I hope you don't need it. So we're going to go to Darlene. Darlene, Dr. Marc Darrow, how are you today?
Hi, Dr. Darrow. My question is, I have carpal tunnel really bad. I have it in both hands, but on the left side it's worse, and sometimes my fingers just lock up so that I have to take my hand and open it up. Does your treatment help carpal tunnel?
Yes, it does, but it's not that treatment. It's a different treatment. We use a hydrodissection. I just did one 2 days ago, and I actually called the woman late last night to see how she's doing. She said her symptoms are almost all gone. If it is carpal tunnel, though, carpal tunnel means that the carpal bones and the tendons that are around the median nerve are impinging on that nerve, which comes down from your neck and down the arm and through that little part in the wrist called the carpal tunnel. And by overuse, people like postal workers, guitar players, people that overuse themselves at the wrist, that nerve can get inflamed. And then it's squeezed by the carpal tunnel. So what we do is we put a needle in there with solution, and it sort of pries all that stuff away from the nerve so it can heal up again. So that's carpal tunnel. But you said that your fingers are locking. That's not carpal tunnel. Carpal tunnel ends up being weakness in the fingers and the hand with paresthesias, which are funny feelings down the fingers. If yours is locking, that's called trigger fingers. That's something different. Okay?
Is there a possibility I have both? Because I had the
yeah. Very possible you had both.
Uh-huh.
You said you had something. I didn't hear what it was. You had something?
Oh, I've had the nerve test that they do with the needles, and the test results came back that I did have the carpal tunnel in both sides. Okay.
Well, that's not, the carpal tunnel doesn't cause locking of fingers, though. Mm-hmm. That's why you might have both.
Okay. So would your treatment be able to help me for both, or?
I have to examine you and see what's going on. It's possible.
Okay. And you say that you do take some of the insurances?
You know, we don't talk about insurance, which is so complex. I can't even get into it. I don't even understand it all. There is some that we take. What's that?
I would be able to call the office and speak to someone.
Yeah. The number at the office is 800-300-9300. You can call there. You can even call right now if you want. There's always people around. And if the phones are busy,
and I think I remember you from Rancho Los Amigos Medical Center because I'm an employee there also. And
yeah.
Uh-huh.
I was the guy. I was the guy that was running around on roller skates from patient to patient. It was busy over there. My God, which department do you work in there, or did you work in?
Urology clinic.
Urology?
Yes.
Okay. Yeah, they needed that because.
But I have worked with Dr. Chambers before.
Okay. Wonderful. It's a great institution. Rancho Los Amigos is one of the premier rehab hospitals in the world. It was a great gift for me to be able to work there for a couple of years. All right. Well, Darlene, God bless you. And there's good help ahead for carpal tunnel. Usually,
I can call today, or will I have to wait until Monday to call to speak?
No, you can call right now. All right, Nita Valens, thank you so much. I'm going to give out the phone number one more time for people that want to call, 866-870-5752. You can call the studio. And then if you want to call the office, it's 800-300-9300. To catch me, do an email through the website. It's www.lastemcells.com. Thank you, Alex. Thank you, Suzette. And God bless you, everybody.
See you next time.
Yeah, thank you.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.